And we are so pleased to have in our studio Dr. Char Brar, who is DNP, started her career at Jesse Brown VA in 1993 as a student and is currently the clinical director of whole health systems at the Jesse Brown VA. She has a strong belief that holistic approach is the best way to help heal a person as it addresses mind, body, and spirit of the person. She has always implemented the approach in her clinical practice, and she completed her fellowship in integrative medicine in March of 2018. After that, she moved from her cardiology practice to whole health systems to be an integral part of the wave of redesigning healthcare delivery systems nationally. Doctor, thank you so much for being with us.
Thank you, Mr. Kelly. It's such an honor to be here.
Yeah, absolutely. October, as we ought to tell everybody, is Breast Cancer Awareness Month, and that is one of the things that is important. America's Heroes Group Roundtable, with, of course, our partner is Jesse Brown VA, as you probably know.
Yes, sir.
So we are so pleased to have you here.
Thank you so much. It's such an honor.
Oh, listen, it's an honor to have you here, and what Jesse Brown does and all of the things that you are doing with your career. Talk to us. This is important.
Yes, it is. It's I'm the clinical director of Whole Health, but what Whole Health is, that's what I want to explain. Our conventional medicine treats the body of the person, and we treat diseases, symptom management. But whole person is mind, body, spirit, community. All those things, they make a person whole. And the whole health systems is the way to go to treat the whole person. So VA is on that journey. We are listening to the veterans, we are listening to the people, and VA is a champion in whole health. So what we are trying to do is take the approach from symptom management, episodic care, to a care on a continuum, where a person builds relationship with a provider, is an equal participant in their own care, and they dictate what they want, what matters to them, in addition to what's the matter with them. So we are changing the conversation. We are changing the context. So when the patient comes to his doctor or her doctor, they are making a plan with their provider, with their health care team, by telling them what they really want to live for. Wow. We have become a disease management society. But what we really are, we really need to be a health system. We should live for healthy, and we should focus on well-being of a person. Because when you are well, you can do something. Life is worth living. So our conventional system is not doing that. We need to move more towards holistic care, where patient or person in collaboration with their healthcare team design their own healthcare plan.
You know, doctor, that sounds so sensible, but how many people even know about what you're saying? And even when they do find out, doctor, I'm sure, how many doctors are there like you who do this whole health care?
We are on the journey. And
okay,
I want
this is sort of new, isn't it?
It has been going on for quite some time now.
But
the
to
Office of Patient-Centered Care has been working, but right now, Jesse Brown VA is,
Great.
really going gung-ho with this approach. And before we go any further, I want people to note this hotline, because without the person who's supposed to be in the seat, we can't go anywhere. We want our patient, our veterans, to partner with us to go on this journey.
Great.
Right? So the whole health hotline number is 312-569-5395. Again, the number is 312 569 5395.
Okay. Now, who, Dr. Brar, who should call that number?
All veterans should call that one number, whether you're healthy or
Wow.
actually it's best when you are feeling good to join Whole Health, because then you have started, you can make plans, you're thinking better, you can make decisions, and this will link you to Whole Health Coach. So let me explain a little bit about what Whole Health System is. It's not a department, it's not anything like that. The Whole Health Systems is a model which is based on what patient wants. So patient is obviously has to be proactive and actively involved in their care. We have like 3 arms to this model. One of them is called as pathways. So pathway is a knowledge, pathway. So it's giving them knowledge about how to take care of them. In this, they can actually partner with a whole health partner. They can partner with a whole health coach who can actually guide them. The whole health partners and the whole health coaches are non-clinical people. So they are non-clinical.
Non-clinical.
And they are going to educate the veterans about what whole health is. And the way you can enter is Intro to Whole Health. That course is a group course, and it's offered every first and third Wednesday of the month. So they can walk in.
Third Wednesday, okay.
First and third Wednesday of the month. You can walk in. It's in the library, in the Veterans Library. Then we have another course that is a 6-week course. It's taking charge of my life and health. So whole health is proactive, right? So we want to educate veterans how and give them skills and equip them so that they can figure out how to really take care of their life. So we have been telling all along how to take care of the medicine, take their medicines, how they should be walking, they should be eating better, but we really don't give the skills. So this system right now is giving them skills how to do these things that we need them to do or want them to do, or the veteran themselves want to do. So they are going to guide what they can do, what they can't do, what they need help with. So once they are in a partnership with a coach, they can now, the coach can work with them and help them figure out what matters to them. Because one of the key things is, how many times in life do we ever take time and ask ourselves, what really matters to me? What brings me joy?
Wow.
We are a society that is now on autopilot. We are always on the go. I don't know where we are going, but we are always on the go, right? We are always in a hurry.
Are you a psychiatrist too?
No, I'm not.
Let me give a call-in number. This wonderful doctor is giving us some great information. Our call-in line is 312-374-8130. If you have a question for the doctor, we certainly appreciate you calling in. 312-374-8130. Please continue.
So those are the courses we have taken. Intro to Whole Health. Second is Taking Charge of My Life and Health. That is a 6-week long course. It's a group. And then we now have also started Taking Charge of My Life for women alone. So women, if they want to do their group setting, then they can do that way. Now, if they don't want a group setting because there are certain people who are private, then you can just call this hotline and leave a message that I want to be with a whole health coach. And this whole health coach can then help them figure out what really matters to them, what their goals are in life, what they would really want to live for, and find their mission, aspiration, and purpose. One of the things that we have realized is, or VA is realizing, is that when we are on active active duty, there's a mission and purpose.
Sure.
And when we come back, it's kind of harder to integrate into the society.
True.
So now if you sit down and pause and listen and say, hey, what really matters to me, and I want to live my life the way I want to, with the goal of what matters to me, then you are happier, right? For example, one of your goals may be, I want to spend more time with my life, with my family. Right? So what about family? So it's like, okay, I have not been able to go on outings with them. I am not able to do certain things. I want to walk my daughter, down the aisle. I want to spend time with my grandchildren, but I don't have energy, right? So that's what matters to you. That's important. Now we build your goal, shared goal with your provider and your coach around that and help you achieve that goal.
We started off, Doctor, in the introduction, saying that October is Breast Cancer Awareness Month. Think pink, as everybody's saying. You're talking about everything, though.
That's whole health.
Yeah. This is, but that would include the same thing, right? I mean, you're saying, I'm sorry, go right ahead.
Any problem you have, I mean, diabetes, chronic diseases. I wanted to talk about that a little bit later after I explain the whole model.
Yeah, go right ahead.
So that would include that. You you set up a shared goal with your provider and go from there. So the next arm is well-being arm. So there is a well-being arm, which means whole health coaching also, but like what exercises, what kind of food, what kind of things you want to do, you will set up that goal. And we have all those services at the VA. We can connect you with those, which could be yoga, Tai Chi, nutrition. We have a healthy kitchen. Every second Thursday of the month, you can walk into the, third floor Damon Building kitchen, and there's a chef, dietitian, who cooks and teaches you how to eat healthy. We have dietitians who teach you how to shop well, do things like that. And then the third arm is the clinical arm. So the conventional medicine doesn't go away. We are integrating the, other modalities which can help you get better along with the traditional medicine. And that treatment arm that we call has also acupuncture, have chiropractic care. So pain management is a crisis, right? We have narcotics, we have all these substance abuse, addiction going on. And that's mostly because of pain and mental health problems. And these can be managed not just with medicines. Obviously, with the medicines, we have realized that there's not enough pain relief. These modalities, chiropractic care, acupuncture, they can help pain. Mindful meditation can help pain. Healing touch can help pain. There are so many other things that we really need to do, because often the pain is from emotional and mental issues.
Wow.
Acute pain you can manage. You got surgery, you got medicines will help, right? Not that other modalities won't help. The complementary medicines, we don't call them alternative anymore. I want to make that clear, because they don't replace the traditional medicine.
Let me say quickly, Doctor, I'm not into pain. I'm not into pain at all. And the only reason I went through acupuncture here in Chicago was because years ago I was in China.
Yeah.
And I was sitting there at this doctor's office, and the gentleman, he was sticking pins into his face, and he was closer to him than I am to you now.
Yeah.
And the gentleman wasn't flinching. I said, hey, this must work. So,
yeah.
And so later on, some years later, I said, hey, And I mentioned it to a doctor. He says, "I know an acupuncturist, and it does work." Yeah, if you let it work.
Yeah.
You have given us so much information. Please, now, can anybody, Dr. Brar, can anybody get this service that's a veteran?
Yes.
Okay.
Anybody who's a
veteran.
veteran can
Okay.
access these.
Okay, now you got to give us the number again. This is just great.
So the number is 312-569-5395.
So any veteran can call that number, and what do you ask for when the person picks up?
So when you pick up, it's going to connect you with whole health, which is basically whole health coaching pathway programs, whole intro to whole health, those classes. So they can get into that class, meet with the veteran, with the whole health partner, or the whole health coach. But you also, I want to tell you one more thing.
Sure.
That these classes, intro to whole health, are also run by the facilitators who are veterans.
Great.
So
Great.
you have the same people, they're
That's
talking
great.
the same language, right?
That's great.
There's an understanding. So what happens is that when you build that trust and that relationship, now you are integrated into the system, and from one line you can get into the other. And then when you another thing is personal health inventory. They will help you fill in your personal health inventory. How many times did you get to write your own note in your chart?
Never.
Never.
Right.
Now,
They won't even let you read it.
now you have a chance to
Yeah.
write your own note. You right? It's personal health inventory. Basically, it has questions like what matters to you in life, what brings you joy. Then it asks you, where are you right now? Feeling physically, emotionally, mentally.
Doctor, we are out of time, but you are just great. I got to give this line again, the hotline, 312-569-5395. Thank you for coming in.
Thank you
Great
so much.
information that I'm sure most people didn't even know existed.
Yes.
And thanks to you and America's Heroes Group.